Over 1.4 million persons suffer from prostate cancer. It is reported by World Health Organization, ranking prostate cancer the fourth out of 33 different types of cancer found in humans, but also the second most common found in men. Aisha, welcome to the program.
Thank you so very much.
It's always a pleasure to have you here with us. And today we are talking about prostate cancer. What exactly is prostate cancer?
Prostate cancer is cancer of the prostate. And if you want to ask what is the prostate, prostate is the gland that secretes seminal fluid that helps to transport and nourish the sperms. And it is located below the bladder and in front of the rectum, surrounding the urethra.
Okay. How common is this prostate cancer, and who is at risk of having it or of being affected?
Well, for how common prostate cancer it is, a study has it that in statistics carried out in 2022 indicated that 1.4 million individuals or new cases were newly diagnosed of prostate cancer. And the statistics equally has it that 375,000 people died of prostate cancer. So that is really a huge number. Exactly. And for those that are at risk of prostate cancer, it is men, because only the men have the prostate gland. So they are the men, and men of the age of 50 to 70 that are mostly diagnosed of prostate cancer.
So when it comes, women are out of place when it comes to prostate cancer?
Yes.
What are the main causes or risk factors associated to cancer?
Causes or risk factor, this greatly depends on who are, or we will divide them as modifiable risk factors and non-modifiable risk factors. That is to say that with the modifiable risk factors, these are certain risks that can't be adjusted, or if adjusted, you will not be predisposed to having prostate cancer. And here we'll be talking about lifestyle for people that are living a sedentary lifestyles. Here we'll be talking about people that are on high fat diet.
Fat?
Yes. Mm-hmm. And we'll equally
when we talk of fatty diets, examples?
That are taking a lot of pork.
Okay.
Yeah, anything that has a lot of fat.
Okay.
Okay. And people that eat less of vegetables or fruits, because vegetables and fruits have antioxidants and nutrients that could help prevent you from having cancer. Yeah. And equally, we can be talking about people that are obese. Those are lifestyle changes that can be modified. Okay. Yes. So these people are at risk of developing prostate cancer. And for the non-modifiable, here we'll be talking about age. There is nothing you can do. If you're 60, you're 60, you're 70, you're 70. And we can equally be talking about hereditary. People that has a lineage of genetic mutation, or their mother, their father, uncle, brothers, one or two had died from prostate cancer, especially if they had it at a very young age. Then they should be thinking of start doing certain things to see into either they are either diagnosed early or they are rolled out of any genes that would cause them prostate cancer. Okay, that's fine. So what are some of the signs of prostate cancer? For signs and symptoms of prostate cancer, we always classify them in 4. And the purpose of the classification is just to make sure that if you're able to pick 1, 2, 3 out of all this classification, you should be able to say, okay, I need to see a doctor. And for the classification, we'll be talking about 1, the urinary symptoms. Okay. Now for the urinary symptoms, we'll be talking about frequent urination. Okay. We'll be talking about painful urination. We'll be talking about pain, difficulties in initiating urination or stopping urination. Okay, and we'll be talking about blood in urine.
Blood in urine?
Yes, blood urine. And the next, we can go now to the sexual symptoms,
okay,
where we can be looking at difficulties ejaculating. We can be talking about difficult sexual activities, and we can be talking about bloody secretions.
Okay.
Yeah. And from there, we can go to the pain symptoms that you're going to have. I have talked of painful urination. I've talked of painful ejaculation. Now we can talk of pain in the hips, joint, and back. This is after if the prostate cancer has metastasized into the bones, into the lymph node, you are going to be having pains on other parts of the body. And then looking at the general symptoms that one could have, we'll be talking here about loss of appetite, we'll be talking about fatigue, we'll be talking about weight loss, unexplained weight loss, and generally other symptoms that comes with cancer.
Okay. Okay, how can prostate cancer be diagnosed?
First off, every disease condition can be diagnosed by history and signs and symptoms. So with the signs and symptoms that you're giving or you're telling your health provider, they will be able to suspect or query the fact that you're having or you might be suffering from prostate cancer, number one. Number two, it can be diagnosed using what we call prostate-specific antigen testing, which can be done in the hospital. And number three, we could talk of digital rectal exams. Okay. Now, most often we don't talk how exams are done because we don't want to frighten the public. Yeah, because somebody will be like, oh, they will send something, but the person say, I'm not doing that one. So we just tell you how you can do it. Go to the hospital and get it done. You get there and you see how it's supposed to be done. Okay. That way you're already there. There's nothing you can do about it. Okay.
One question is, prostate cancer, is it treatable?
Yes.
Okay.
Prostate cancer is treatable if identified early or if diagnosed early. Now, when we talk about the treatment of prostate cancer, it will depend on many factors. First, what was the state of the cancer before the diagnosis were made? Two, what is the health of that individual at the moment? Because somebody might be suffering from prostate cancer and the person is having hypertension, diabetes, and kidney problem, liver failure.
Everything put together on him. You
cannot tell me that that is going to be the only problem. Now we have so many problems, okay? And equally, we can be looking at, apart from just looking at the state of the cancer when it is diagnosed, we can equally look at the individual himself. If this individual is somebody that is of high risk individual, if we are talking about treating prostate cancer in somebody that is obese, we need to start somewhere before getting here. So
maybe now, start by reducing the obesity.
The duration will be much. So yes, it can be treated very much, especially if it's diagnosed early.
Can someone suffering from prostate cancer, can this condition lead to further complication or lead to some other things?
Yes, of course. Because here we are talking about, I made mention, when you want to talk about signs and symptoms of prostate cancer, you'll be talking about urinary symptoms, you'll be talking about sexual symptoms, you'll be talking about pain, you'll be talking about the general symptoms. These are the different aspects, or these are the different extent in which when it affects you, you will not start having problems with the neighboring organs. If you have prostate cancer, it inflames your bladder will start getting affected. That is where we start talking about frequent urination. That's when we start talking about pain upon urination. And that's when we start talking about bloody urination. Okay. Now, because of the cancer, you can now suffer from difficulties in erectile dysfunction, you can have painful ejaculation, you can have difficulties in having sexual activities. These are already it going on another level. And if there is metastasis, we can talk about the lymph node being affected that can generate into the whole body. We're talking about the bone, the spine. So yes.
Okay. What message do you have for men suffering from this?
Before we get there, I think there is something I wanted to add on the treatment. Because prostate cancer can be treated through surgery, it makes it easier for it to quickly be treated if it is diagnosed
early.
Yes. Because now, how can it be treated, or what are the treatment options that we can have? Here we'll be talking about for people that are of age more than 70, or people that are 50 years, let's say 65 years to 70, and having other disease conditions. The doctor might decide to put them on active monitoring or active observation. They can be observing the growth, they can be observing their lifespan, they can be observing other activities to make sure that, okay, we don't get to the surgery. And because of their age, it is okay to have them live their life according to how they are supposed to live and die in time, instead of trying to inflict pain on them through surgery. Again, if it is diagnosed early at the age where, at the stage where it is still not metastasized and you can easily remove, you can just get into the theater and it is removed surgically. You can do chemotherapy, you can do radiation therapy, and all of these. There are people that talk about traditional medication. They know what they are talking about. We don't deny the fact that it works. It is one of it. The herbal treatment can go for it. So yes, those are the different options that one can take for the treatment, and how it is chosen depends on yourself and the health provider.
The state. Okay.
Yourself, the health provider, and the state of the cancer, as well as the availability, because we are in Doha. All right. If I want to go for radiation, I definitely will have the possibility to go for radiation. Chemotherapy, they will have medications for which I can take. And if I want to go for, say, surgery, I'll have the best surgeons to do that. But now check, for example, one of my uncle or my father in Batibo, if he wants to go for radiation, where would they radiate it? Sunlight. It's not going to be available. So the availability equally plays a role.
What message will you give to men regarding prostate cancer?
Well, the last message I will think that is very necessary for men is that I know most or some men have the don't care attitude, and they feel like hospital is meant for women and children. No, hospitals are meant for each and every one of us, be it men, women, children. We all can get sick, and we should go to the hospital to get treated. In that light, if you are a man out there and you have any of these signs and symptoms, you have any disposing or risk factor that might prompt you into, or that might be a cause of you having prostate cancer, please go to the hospital and start doing your screening, because early screening will help you get a solution in time. Equally, when we are talking about prostate cancer, it should be noted that most often it affects men. For those that are high risk, it can be as early as 40, and for those that are average risk, it can be as late as 65 or 70. So within that range in time, as a man, at least talk with your health provider, identify your risks, if you're high risk or you're low risk, and try to take steps in making sure that you go for your screening. And if you are already tested positive for prostate cancer, there is a solution and there is a possibility in which this can be treated. So do not be afraid. You have varieties of options for which this can be stopped. Just go to the hospital, get tested, get treated, and you will be fine. And you can live long with your family to enjoy your old age. Thank you.
We have this controversial message coming even from medical personnel related to the frequency of intimacy. I have heard or even seen medical personnel saying that the frequent, like having sex more often can prevent prostate cancer. How true, how valid is this statement?
It is not scientifically proven to be directly related as a preventive measure. However, the American Journal for Cancer had published a study that was carried out indicating that men in their 20s who ejaculate, it is not necessarily sex. Okay, men who ejaculate as often as 21 times in a month have the possibility of reducing the risk of having prostate cancer. However, do not say it is coming from me. It has not been proven.
Yes.
I did not say it too. It has not been proven. So don't go and kill yourself doing things that I don't know. It cannot be proven though.
Now, statistics have shown that badly affected regions or continents include Europe, US, and Asia. And Africa is, I think, one of the least. What accounts for that?
Well, if we are talking about the true cause of cancer, it has equally not been scientifically indicated that this particular thing is the cause of cancer. Because when we are talking about health, when we are talking about science, when we are talking about medicine, it is said that when you identify the cause, you remove the cause and you will not necessarily have to treat it. If this place is mosquito infested and people are suffering from malaria, if we know that it's just caused by mosquito, we can prevent mosquitoes and hence there's no malaria, right?
That's right.
But there is nothing that is specifically saying that this is the cause of cancer. It might be said that it is most men that are diagnosed, or they say 1 in every 8 men diagnosed of prostate cancer is an African American or is a Hispanic. That has not been identified. We cannot really say for what purpose, for what reason this is happening. You aren't lucky because you are an African. We don't just know.
Yeah. Okay, ladies and gentlemen, that is how we put an end to the program Health Talks with Bibi.